Welcome back. Skin cancer is now the most common form of cancer in the U.S. 1 in every 5 Americans will develop skin cancer, and it's even more likely in Sunbelt locales like Charleston right here. So when caught and treated early with a procedure code called Mohs Micrographic surgery, the success rate is 99%. We've got Dr. Todd Schlesinger and Dr. Coakley here from the Dermatology and Laser Center of Charleston to tell us more about the procedure. Gentlemen, thank you for being here.
Thank you for having us.
Thank you for having us.
It's scary. 1 in 5? Has it always been that way, or are numbers increasing?
Well, I think the detection rate's increasing over time as we're getting better and better and educating the consumers about the skin cancer risk.
Yeah, so while it's scary to see numbers so high, you guys have this procedure called the Mohs. It's M-O-H-S. That is highly effective and not as invasive as some older procedures. Tell me more about it, and how does it work?
It's really a great technique because it allows us to remove all of the cancer, the 99% success cure rate, but also leave as much normal skin as possible behind.
Okay, so we're looking at a diagram that kind of shows it step by step. Kind of walk me through it, how it works.
Well, as you can see, skin cancer can grow roots like a tree. And so when you cut the skin cancer out for a normal method, you can't see all the roots all the way. So Mohs surgery allows you to get all the normal skin, all the skin cancer out with just the smallest amount of normal skin possible, so you can take the smallest hole possible and close that in the most pleasing way cosmetically.
Okay, and so before you'd be cutting a lump, if you will, pulling it out, and there could still be roots that you weren't getting, and now you're allowed to get that.
Yeah, exactly. So with the traditional technique, not only do you not have as high of a cure rate because you can't guarantee that all the roots are gone, but you're taking a larger piece to try and make sure that you get it all. So that makes a big difference when you're talking about removing a cancer on your nose, where you don't have a lot of extra room to remove extra skin. The fact of the matter is most of these skin cancers show up in areas of skin that are exposed to the sun. And that's our face, our neck, places that are very cosmetically important to everybody. So by using this technique, not only is the cure rate outstanding, but people still look normal afterwards because you're removing a very small amount of tissue and repairing it.
Which is good aesthetically, like you said, if it's in your nose, your
face.
We're watching an animation here of it growing, you said as it grows roots. So let's say I go in, you find something on my nose, you said for example. What's the whole procedure like? Is there a downtime? How long does it take you to remove something?
So on average, the Mohs procedure takes about 4 hours.
Okay.
So you'll come into the office, make you comfortable, identify the site, go over the procedure with you briefly. And once you've had your consent, basically we'll take a small piece, we'll numb the area with local numbing medicine, so the whole process is completely painless.
Okay.
So we keep it, and once we numb the area and the area is numb, it's painless from there, that point forward. Take a very small piece, you'll wait in a comfortable lounge to relax while we're examining the slides. And the key is that the same surgeon that's removing the piece also examines the microscopic slides. So there's a very high degree of precision that's there because you can follow the cancer from the body to the microscope, and you can correlate the two.
You remove it, you look at it.
That in there is why the precision rate is so high, and that the cure rate is so high, and that the recurrence rate where the cancer can come back is extremely low.
Yeah, and obviously we want to catch it early. So what are some, you probably have people at home freaked out, like looking at their arms, I know there's different signs, or the ABCDs of moles that we should kind of watch out for signs.
Yeah, so for melanoma, we're looking for melanoma, which is the deadliest type of skin cancer. So the ABCDs are shown here. So we're looking for asymmetry. If a mole has irregular borders, if its color is abnormal, if the diameter of the mole or the size of the mole is larger than a certain size. But the key thing actually is E, or evolution. Evolution means change. If there's a mole on your body that's changing out of step with the rest of your moles, that can be concerning. You should see your dermatologist.
Yeah, and obviously we should keep a watch on ourselves, but you guys are the experts, so you recommend an annual exam to go in?
For a sunny place like Charleston, South Carolina, it's important to come in once a year to really be screened head to toe. I don't remember the last time I looked at the back of my knee for a spot.
Can't really see it.
And most of us don't. So by coming in and having a professional examine you can have the confidence that you are skin cancer free. And with the statistic, 1 in 5 of us will develop a skin cancer. That's pretty high.
Yeah, and is it surprising sometimes, like you may have a large one and that's actually fine, but sometimes they can be very tiny. That could be precancerous, right? The size doesn't always matter.
The size doesn't matter. I mean, to some extent, we also use a little technique called dermoscopy, where we can look at very small things on the skin. So if we see a little spot in the skin that you really can't tell by the naked eye looking at it, you can use a little handheld microscope to really get a clear view, and sometimes that can help you detect skin cancer earlier.
You guys are so smart, so talented. Thank you for all you do. Where do we go for more information on Mohs, and more importantly, to book a skin check with you, or if we think we have something that's wrong?
So the best place to start is calling our office. The phone number is 843-556-8886.
Yeah.
Our website is a resource of information. You can do all your scheduling and booking from there.
All right, thank you guys. Such a pleasure to
Thank you
talk
for
to
having
you.
us.
Very nice meeting you
Thanks
this
for
morning.
being here. And we've got more Lowcountry Live. We've got East Cooper Meals on Wheels right after this.